our briefing today, and you know our healthcare community and our National Guard General is with us, but we've got several things to go over again today. I'm going to go through the different points that our healthcare community as well as our general is going to be speaking to you about in a little while, but I think it's kind of important for me to just go through point by point, and then I'm going to get on with another announcement beyond that. From the standpoint of cases, last night, as of 7 o'clock p.m. last night, we had 16 positive cases within our state. One of those cases is a nursing home lady, and that nursing home person that is affected and everything with this terrible virus is really important because it's a different situation in that we've had many people from across state borders come in and out, and we had a way of identifying that we were basically exposed to out-of-state border people. This is the first case we've had of community transmission, and so it is really significant. If you'll remember back days and days ago, we stopped all visitation at our nursing homes in trying in every way we possibly could to avoid, some level of contamination that could cause us a potential problem. Now, with all that being said, thank goodness we did that days and days and days ago, but it is still a huge concern. Now, I have also asked our Secretary Crouch, who will be speaking later on and everything, to daily inventory our hospital beds. And he is working at that just as we speak. Dr. Schlemp, who's with us right now, can later on tell you a lot about how we are ramping up our testing. We now have 49 hospitals out there that are now submitting tests to our public and private labs. We have 19 communities that are ready to do community-based testing, and we have at least 1,500 people that now have had tests that have been submitted, and we're awaiting those results. We're working closely with all the private organizations to ramp up our capacity, and we have taken necessary steps to be able to increase our state labs capacity as well. Our general over here, who is a great man and does incredible work all the time, has sent 4 members of the Guard to go to the nursing home where we had this positive test and to test everyone there. They left last night to do just that. In addition, there's a vehicle that's en route to Maryland to pick up needed supplies and protective suits. Our general is working with our tourism commissioner, Chelsea Ruby, along with our state superintendent of schools, Clayton Birch, in order to be able to address this feeding problem that we have. We've got to be able to feed our kids. And I want to have a special thanks to 100+ restaurants and hotels that are offering up their assistance in this feeding program just as well. General Hoyer is going to report on, he's working with the U.S. Corps of Engineers, and they're working all together on the sites that we previously thought about in the Fairmont, the Williamson now, Wheeling, St. Francis, and Sistersville areas to have additional bed space and have them staffed properly and everything from the standpoint of supplies in case we've got to use them. Dr. Clay Marsh is with us today, and Dr. Marsh and I speak 50 times a day, but nevertheless, we spoke last night about the possibility of reaching out to the med schools and see if the med schools could help provide people as well as potential dorm rooms from the standpoint of if we have a surge and an absolute overflow need there. I think he'll announce today that WVU and Marshall were very willing, and we got that approval almost instantaneously. So special thanks to those universities. From a standpoint of workforce, we are processing unemployment claims at light speed, and people are working around the clock to do so. Last week, we processed 17,000 claims, and I really expect that to even just go higher. As far as our state parks, I'd like to read this to you. As part of the continuing of protecting our citizens and the safety of our workers, I am ordering today that our cabins, which we left open, and our restrooms be closed to the public as of today. Our trails will still be open, as well as our streams and our golf courses and walking. All that, will be in effect, no problem, all today. The last thing that I have on this kind of bullet list is just this, is on Wednesday of this week, and we need to do this really badly. We're going to declare Wednesday, March 25th, a day of state prayer. And we're going to have a nice program, and we're going to invite all of our religious leaders to come and join with me in a day of state prayer. And because if there's any time, and I believe it's all times, but it's surely if there's any time, now's the time when we need to be looking to God above for assistance in any and every way we possibly can. Now, if I could move forward, and now it gets even more gravely serious. I want you to know that I always want to be fully transparent, and I want to report to you and come and speak to you anytime that I have any news whatsoever or feel a need to be able to talk to you. It's important that all of us understand the magnitude of this situation today. The magnitude is unbelievable. It's hard for any of us to get our arms around and truly understand. But really, when it really boils right down to it, it's the biggest event of any living person in the United States today, period. That's all there is to it. There is no event ever in the history of time that has been like this to all the living people that live in the United States of America today. Now, the other thing that is difficult maybe to understand is how fluid it is. This changes every hour or two. This is not something that you can lay aside for a couple of days or a day and then discuss more details at that time. Our people are working around the clock, as well as myself, and we're on it, and we're on it as best we possibly can. We've done good stuff as far as pushing the right buttons, and that has led us to only 16 positive tests at this time. But we've got to realize just this. We are a very high risk, if not the highest risk state. And so we've got to keep aware of just exactly that. We've done things from preparedness to proactiveness to closing schools to closing bars and closing restaurants and all the different, the state of emergency, all the different things that we've done. Now, I'd like to give you a little insight into my discussion with you on Saturday night. I want to tell you exactly all the makings of everything because it's important to me that you know. On Friday evening, I was contacted by several of our different, as I was with you, I was contacted over and over that we had taken all the necessary steps that we needed to do. Every one of the proper necessary steps we were right on track with. Then on Saturday morning, additional health officials called me to advise me that they felt like that I needed to go on and give you an address to try to urge you to do just one thing that I did. Do better. Do better, because we were in some ways winning the battle, but in other ways we were losing the battle. Everyone needs to be very, very, very concerned. Now, with all that being said, I didn't want to go through the weekend, and I surely would not go against the advice of our medical community. At the time that we went on the air, every single one of us, all of us here, all the medical community, the Guard, all of my people within my office and everything, no one thought it was necessary at that point in time to take the biggest step forward and shut the entire state down. Now, things continue to change. We met again all day on Sunday. Through that time, there are bordering states that are taking actions that will basically cause folks from other states maybe to make their ways into West Virginia. It's a real problem. We can't have that happen. Now, the next thing that happens is we have a positive from one of our own nursing homes, and that is tremendously concerning. You know, when I was planning to meet with you at 11 o'clock this morning, my intentions was at that time to close all of the non-essential businesses within the state. Even more things have changed now. And since that time, you know, I have had more consultation back and forth with our health officials, and it's become even more serious. So therefore, today, I am moving forward right now with a stay-home order that will go into place immediately. This order also temporarily shuts down all non-essential businesses. The order will go into effect at 8 p.m. tomorrow. Now, let me tell you a little bit about what a stay-home order is. And I'll start with what it is not. A stay-home order is not martial law. It's not going to be that somebody is going to come and lock you in your home. It's not that we are shutting down the state borders. It is not that we're closing any bridges or roads. And we can do all this and slow down this terrible virus even more. Now, let me tell you what it is. It's just this. You can leave your home to perform or receive essential services, or if you work at an essential service business. Now, what does that mean? It means you can leave your home obtaining food, medicine, and necessary medical care. You can go to work if you provide these services or support them. You can go check on family members. You can go to your place of worship. It means you can do outdoor activity, and it highly recommends that we minimize that to below 10 people and to a 6-foot space. If your business or operation is not essential, then you'll be temporarily closed. It is an executive order that all the details are on my website. Now, let me just say this in conclusion, and then I'll pass off to these others. We have absolutely been proactive in every way, shape, form, or fashion. We have been transparent beyond belief. We have encouraged in everything else when we actually could draw criticism. We have absolutely done and pushed the right buttons at the right time, but it's still not enough. This disease is really serious stuff. Please stay home. Please listen to our orders. And please, in every way, shape, form, or fashion, keep consulting your God above. And absolutely, every one of us will get through this. Help the elderly in any way you can, if all you do is pick up the phone and make a wonderful, nice call. But anyway, I thank you from the bottom of my heart. We'll take your questions in just a few minutes, and now we'll pass on to the others.
Ladies and gentlemen, as part of our briefing today, our friends with the media are once again joining us by teleconference. We'll be taking their questions in just a moment, but first, we're going to take a few comments from our panel members. First up is Dr. Clay Marsh. Dr. Marsh, go ahead.
So it's really an important moment, I think, in this pandemic that we're seeing today. So we've worked very closely with the Department of Health and Human Resources, with Secretary Crouch and Commissioner Slemp, with the governor and the governor's office. And I would say all of the medical schools are committed and connected around supporting the state in any way that we can, and all of the hospitals similarly. We had set up at the very beginning of this process an approach where we were going to look at two things. And this is what the governor alluded to. So the two things that we were going to use to make decisions about how we should move were, number one, the rate of positive tests related to the total number of tests that we did for the novel coronavirus, because we knew at some point we would see a great uptick when the coronavirus spread started to go into a logarithmic kind of phase. And the second one was to look for community spread, because if we had community spread, or we would see that there would be a really stark and frank elevation in the rate of spread, then we would know, one, our healthcare workers and healthcare assets would be at risk of experiencing the tsunami wave that I'll talk about in just a second again. And number two, for the community spread, it means that now the coronavirus is inside the state. It's not just people coming from outside the state. And so therefore, we knew that the preventive measures that we were taking was not sufficient to stop the spread of the novel coronavirus. And as we've talked about quite a bit, and as New York City has experienced, that if you don't stop the rate of spread, then the rate can start to create a surge or a tsunami wave that then affects the healthcare workers. And when we look again at the mortality rates around the world, if you can control the rate of spread and not have this surge, the mortality from this disease is 1%. If this surge happens, then the rate of, or the incidence of death is 3 to 5%. And Italy, which has a population that is somewhat like ours, has a mortality rate of 8%. New York City didn't do the things that we've done. They have a very difficult situation with all the people, but they didn't do the things that we did. And they prepared, and they had a lot of capacity in their emergency rooms. And initially nobody came, and they said, hey, what's the big deal? But then the surge came, and they're underwater today. Governor Cuomo's asked for 50,000 more beds. Mayor de Blasio has asked for 3.3 million more masks. And we know that by projection, the end of their surge, the peak of their problem, doesn't happen for a month from now. And so when we look at the Centers for Disease Control, that basically projected that we could have 1.7 million deaths, or a projection from the United Kingdom modeling group that said it could be 2.2 million deaths in this country, it wasn't just because of the coronavirus, but it was because the coronavirus can decimate the health system's ability to respond. So I think what Governor Justice has done, and what our health leaders and the other medical systems, the hospitals, the great medical schools we have in our state have done now, is completely appropriate and important. And importantly, as of yesterday, we still hadn't broken through either one of those thresholds. So this finding with community transmission, particularly in a nursing home, and we know in Kirkland, Washington, which was one of the first sites of the spread of the coronavirus in this country, that of 127 nursing home residents, 35 died. And so at one point, about 80% of the deaths in this country was from one nursing home in Washington State. So we don't want that to be us. We don't want to overwhelm the healthcare workers, and we don't want our very vulnerable population to be at risk. So I praise Governor Justice for making this move. I think this is good for West Virginia, for our health, for our future, and this is the moves being very aggressive that can keep that rate of spread of the coronavirus down enough to maintain the health assets. I'll say one more thing that I think is really important. When we first experienced this novel coronavirus, we were understanding from the Chinese experience, South Korean experience, and experience in Italy, that younger people seem to not have the same risk of getting the severe disease that older people. Well, that's changed now. In the United States, 38% of people in the hospital from this disease are less than 55 years old. And we have 20 and 40-year-olds in the intensive care unit in this country. So I think it's really important that young people out there don't feel like somehow they've gotten a free pass from this, because they haven't. So it's just as important that young people in our communities maintain safe distance, maintain good hand washing, and also are paying extreme attention to what Governor Justice has said.
Okay, thank you, Dr. Marsh. General Hoyer, would you like to give some comments?
Good afternoon. Just to reinforce a couple things that the governor's directed the Guard to do. The governor's directed the Guard to use all of its assets available to support agencies that need to be supported in this event. I'd like to highlight a couple of things. As the governor pointed out, we're working with Superintendent of Schools, as well as the Tourism Director, Commissioner Roswell from Senior Services, to make sure that not just our children who need the food support, but the families of those children, as well as our seniors, are taken care of related to that. That's an exceptionally important issue that we need to address, and the governor's given clear guidance on making sure that we take care of that. Another important point of activity that the Guard is doing is the support to our DHHR, our folks at the medical centers, related to data analytics. One of the most important things, in addition to the things that have been described to you, that we can do as a state is to make sure we have good data, good analysis, and good information so that those experts can provide the appropriate information to the governor, just like we've done over the past several days, to stem the flow of the spread of the virus. We're also working on training. We're working on training with medical providers as well as first responders, and we've expanded that into working with the Retailers Association to help do better prevention for those workers out there who are supplying us with the food and the essential services. We'll work with banks and others as necessary, again, to improve the situation so that we limit the flow and the spread of this virus. It's important, I believe, to understand, too, and the governor pointed this out earlier, the most important thing the National Guard can do in this is not put guardsmen on the border to stop people coming back and forth on the border. It's to use our skills and capabilities to support the agencies that need to do the work in this, to be a force multiplier to better understand and address the threat of the virus. I go back to George Washington and the band of militiamen that won the Revolution. If you pay attention, one of the most important things General Washington did was provide the intelligence support to address the threat. Those are the key things that we'll be doing and continue to do, and we'll reach out from anybody that we can support going forward. Thank you.
Thank you, General Hoyer. Up next, we have Secretary Bill Crouch and Dr. Kathy Slimp.
Yes, I'll be very short. I can't add too much to what the governor said and what Clay or General Hoyer said. This is the right move at the right time. I personally was hoping it was going to be down the road a week or 2 weeks, and that's the reason for several weeks we've been talking about physical separation and making sure you use good hygiene. It's one of the things the governor expressed again on Saturday night, to try to make sure we move this forward so that our healthcare facilities in the state have the ability to care for these folks over a period of time. So the other thing I'll mention is our healthcare workers. We have some folks out there who are heroes. This is it's a tough time for everyone. It's a situation that we've not been in before like this. We really have no reference point. but we'll get through this. We're going to support our healthcare workers. We're going to make sure that we do all we can to keep them safe. Kathy?
Great. Thank you. I too fully concur that it is time to make this transition as in terms of we've now seen community-based spread initiating there. I think I'd talk about three areas real briefly. One is testing. We clearly are working rapidly to expand testing in the healthcare system because that's where it typically always is and needs to be. Lots of work underway in that arena so that we can move our public health laboratory back to doing its mission of supporting case investigation, outbreak investigation, public health response, which is the other piece that is really needed to manage this event. We clearly, as a nation, you don't have to test everyone to manage a situation. You think about that with flu or other things, you can manage a lot of it clinically. And so we need to be very careful in how we prioritize those tests that are used so that we really make sure they are the ones that make the biggest difference in terms of action. And we can speak more about what that looks like to follow up. The second area I wanted to talk about is the issue of healthcare system support, which Dr. Secretary Crouch brought up, which is so important. Lots of work underway in terms of identifying sources for personal protective equipment and other support systems that are really going to be critical, and so those are actively beginning to flow in and move. The third area I'll really briefly touch base on is when we're doing situations like this, it is clearly anxiety-provoking, and it makes us all nervous. We have to think about how we really connect and reach out to each other, and I think the governor wonderfully mentioned the day of prayer coming up on Wednesday, and I think we can think about our churches are an incredible resource for all of us, and truly, I've been speaking to faith-based leaders, et cetera, and clearly the heart of the church is not based on physical proximity. So while worship in its traditional sense of gathering together in a worship space probably is not appropriate at this point, it doesn't mean that worship ceases, and they're doing it amazingly in creative ways that we're hearing about. We can give examples of those. Nor does it mean that the church's mission in community stops. And so it is incredibly important there now that they are offering that hospitality, that care, that love in ways that are smart, creative, and safe. And so we actually are hearing incredible actions that are underway there, whether it be related to new ways to make sure we feed children or help provide childcare for healthcare workers, or keeping people connected emotionally, spiritually, and socially. In fact, this is a neat thing, we are finding that there are some folks that are saying they feel even more connected and more socially connected because of the intentionality of how everyone around the state is reaching out to connect with each other and check on each other, and just doing that in ways that are not in person. So those are the kind of things that will help all of us really move forward together.
Okay, thank you, Secretary Crouch and Dr. Slimp. Once again, Governor Justice and our panel members are holding today's briefing with media members joining us virtually to practice good social distancing. To ensure all outlets have an opportunity to ask questions, each outlet will be called upon by me. The order has been selected at random. To media members, when we call on you, please remember to unmute the microphone on your end before asking your question. Please confirm your name and affiliation as well. The first reporter today is Stephen Allen Adams with the Ogden newspapers.
The kind of things that will help all of us really move forward together.
Okay, thank you, Secretary Crouch and Dr. Slimp. Once again, Governor Justice and our panel members are holding. Stephen, go ahead. With media members joining us virtually to practice good social distancing. To ensure all outlets have an opportunity to ask questions, each outlet will be called upon by me. The order has been selected at random. To media members, when we call on you, please remember to Okay, Steve, try again.
All right, there we go. Can you hear me?
Yes, we got you.
Okay, all right. My question is this. So the spread of the causing the order to go into the fact that you're talking about, the catalyst was the community spread that you're talking about, right? Or were there other factors that went into you all pulling the trigger on this, because a number of people have been calling for this order, either closing non-essential businesses or a stay-at-home order. There's been a number of people calling for this for the last several days. So I'm just curious what specifically was the catalyst for it. Thank you.
Can you speak to that?
Sure, if you'd like.
I think it really is this beginning to see transmission of spread in the community. So that's the first case or two that we're starting to see with that. And so that's just a trigger point that we've all kind of been thinking about as a key moment to make sure we really are taking that next step.
Can I just add one thing? Governor? Sure. So we know from simulation models that it works best if people can voluntarily sort of stay at home and stay away from each other. And that's what we talked a lot about the 75% or the 90% of people that could do that to take the tsunami wave down to a river or a stream. And one reason why we did not recommend to the governor to do this earlier was because we know as long as we have the opportunity that approach will give us the best reduction of that tsunami wave, that surge down. But once that doesn't work anymore, and that to me is what the community spread indicated, that once that doesn't work anymore, talking with Dr. Slimp and Secretary Crouch, that was when we all recommended to the governor that we needed to take the next steps, because once it's in the community, then it can go quickly. And just as a reminder, in South Korea, the first 30 people that they identified with the novel coronavirus were quarantined and nothing spread. The 31st person spread it to over 1,000 other people. So doing this in a really intentional way to protect the people in West Virginia, but also to protect the surge is, I believe, the reason why it's right to do this at this point.
And Stephen, just a quick little follow-up from me. On Friday, when we got through with our press conference and everything, the biggest concern was throughout Friday night, I just kept thinking, there is no event, no matter what we would say, there's no event that parallels this in any way, shape, form, or fashion. And then on Saturday morning, when others called and said, you've got to go in front of the people and just talk from the standpoint of encouraging more and more and more people to get on board, because we've got to stop people going to the bingo games and everything else under the sun. And so really and truly at that point in time, all of us would concur, that there was no one that was on board as far as going to a stay-at-home order. But after that now you have another ingredient that has really come to play. You've had additional states that could flood us with out-of-state visitors, which is toxic in every way. We can't have that happen. That's A. The next thing you can't have happen is just this. If we definitely now have a case that we've referred to in our nursing homes, then it is really something that we need to act on. And we have tried to act proactively on everything all along the way. And that's why we have kept being last and behind and behind and behind when we're the highest risk state of all. Now, but at the end of the day, all we need to do is just stay focused on one thing, and that is trying in every way we possibly can to save as many lives as we can. In fact, to try to save all of our lives.
Okay, thank you, Stephen. Up next, Anthony Izaguirre with the AP.
This is Anthony with the AP. Governor, after the heavily criticized address over the weekend, do you think you're doing a good job of clearly describing the threat of the virus as well as safety protocols people are supposed to follow?
Well, first of all, I'd be really remiss if I didn't tell you that, my address on Saturday evening, after hours and hours of discussion with these great people behind me, everyone here felt like that I was to go and do exactly what I delivered. And if people really, were anticipating more of a bigger announcement, I would just say simply this, and that is, we absolutely were continuing to try to do everything in our power we possibly could to help as many people as we can along the way. Now, as far as staying on top of this, You know, I am absolutely confident beyond belief that we're doing everything in our power with the advice of all these super experts and everything else to stay ahead of the curve. And our numbers are showing we're ahead of the curve. You know, so at the end of the day, that's what we're going to keep on doing.
Okay, thank you, Anthony. Up next, Charles Young with WV News.
Hi, this is Charles Young. Sir, could you be more specific about the time frame of this? Is this an indefinite order? Is this going to last 24 hours, 48 hours?
Well, I don't know how long it's going to last, you know, but I do know that it goes into effect at 8 o'clock tomorrow. This is for the stay-home portion. This is for the non-essential businesses. This is for all of it. It goes into effect at 8 o'clock tomorrow. You know, again, we can all just hope and pray that this thing, you know, plays itself out over that, what we call that 15-day window that we're already several days into. You know, just think of how proactive our president has been in many ways here and everything. This disease is a pandemic that nobody's seen before. You know, the magnitude of it is off the chart. We will absolutely relax what we're doing immediately upon seeing the numbers and the trend lines that will cause us to relax it.
Okay, thank you, Charles. Up next, Hannah Getz with WOWK.
Hi, yes, Hannah Getz, WWK 13 News. Can you talk a little bit about how these food programs are going to work? I know a lot of families, specifically in Kanawha County right now, are worried about how their kids are going to get food.
I couldn't hear really well. I'm sorry. I didn't get
food. About the food program, Governor, if you want me.
Well, yes, go ahead.
Yes, sir. So, Hannah, continuing to work through the State Board of Education through that system. For the folks in counties that have concerns, please reach out through their superintendents. There'll be information put out related to what you'll see is the normal same distribution process that we currently are working with, a few modifications that need to be made. One of the significant things that's come through is through the great work of Chelsea Ruby with tourism. We have 100 restaurants already who have signed up to support the meal preparation piece of this, which will help us. What Secretary Birch or Superintendent Birch and the team are working on now is we know that we're serving it with kids. We know we're serving 200,000 children. But that to us means a significant number of families. That's not 200,000 families, but it's a number similar to that. So the food packs are now going to be done focusing not just on the children, but also on the families. So in addition to that, we're working with Commissioner Roswell related to the senior program. We're engaged with VOAD, who everybody knows from the 2016 flood, as well as the food bank. Tonight at 5:30, I have a coordination call with all those agencies as we shape out a statewide effort that the governor's directed us to do, and with all those entities to make sure that we are taking care of our vulnerable population in the state. And we'll be able to provide you more data as this develops over the next several days.
I'd like to add one other thing to that too. And y'all all know me well enough to know that I don't blow smoke at anybody. I just try to tell it just like it is and everything. And I would just tell you just this. It's no time in the world whatsoever for us to start trying to one-up each other by politics. I mean, the real truth of the matter is just simply just this. You know, it was brought out earlier today that the governor is what's holding people back in being able to feed our kids. The most ridiculous statement in the world. And it's just nothing but a political statement. That's all there is to it, and it's ridiculous. I mean, it's despicable to tell you the honest truth, because nobody in the world knows the importance of feeding those kids any more than I. And you know, when you're looking at trying to take care of 200,000 kids, it's a big deal. That's all there is to it. And you know, the general was kind to mention, you know, Chelsea Ruby or Clayton Birch or all the people that are on the front lines, whether it be our service personnel that work so diligently or so many different people from the restaurants and everything else. But I am telling you right now, just straight up as it can be, some way, somehow, we're going to feed those kids. I mean, that's all there is to it. And I don't care who says what or whomever, I am not about to stoop down to the idea of trying to do something to one-up somebody from the standpoint of politics. It's ridiculous.
Okay, thank you, Hannah. Up next is Kenny Bass with WCHS.
Hi, this is Kenny Bass with WCHS and WVH's Eyewitness News. Governor or the medical experts on the panel, how can you protect the homeless population, which is throughout the state, but really centered in some urban areas, Charleston, Huntington? I mean, this is a population who might not have access to soap and water on a regular basis, or antiseptic or sanitizers. To avoid getting a cell that would start with that population, what do we need to do?
Well,
there's
let me just throw out just a couple words, and then you guys go. You see, we all know that the virus is killed by separation, and we could have just jumped from A to Z, locked ourselves down in every way, shape, form, or fashion. But in that irresponsible jump from A to Z, in all honesty, what could come right with that is many, many, many casualties, just what you're referring to right there. So we try to protect those in every way that maybe a jump would leave left out. Kathy, if you could.
Sure. Several things I'd talk about, because it's important. We have several vulnerable populations that we really need to make sure we are very, very attuned to. The General has spoken to several, and this is another one. There is a lot of work underway. There's lots of discussions with the continuum of care, the folks that work with our homeless populations around the state, putting in place active plans of how that can be supported. We think about that when we are developing our 1135 waivers for Medicaid. So that we make sure we have available for care, so those things cover the uninsured, it covers housing issues, those kinds of supports that are going to be really critical as we move forward. So it is absolutely a critical piece to work towards and to support.
Okay, thank you. Kenny, up next is Amanda Barron with WSAZ.
Hi there, it's Amanda Barron from WSAZ. Can you clarify what exactly essential businesses are, where those include things like auto parts stores, construction supplies? I know the list on the website says warehouse stores specifically. Also, are coal mines essential? If you could just kind of drill down on what those essential businesses are for people.
Do you want to do the
Certainly, the General may have some information on this too.
Brian, maybe you could come up and give us more clarification. From the standpoint of our coal miners, absolutely they're essential in my book in every way, shape, form, or fashion. We've got to have the ability to have good electricity flowing everywhere at this point in time in every way, shape, form, or fashion. And as we move forward in coming out of this, with our metallurgical producers and all the good stuff that they do, for us from the standpoint of all the components that the steel industry needs, I mean, there's no group, in my opinion, any more essential than our miners.
Okay, to answer your question, the executive order is now on the website. We had some difficulty, I believe we're getting back up now. It's Executive Order 9-20. It's about 15 pages long and it's very comprehensive, but we have followed the U.S. Department of Homeland Security's suggestions for critical infrastructure, as well as we've modeled it after some of our neighboring states that have put this in place. So to tell you that each and every detail of this would be lengthy to sit here and do, but rest assured that many of our businesses are included as critical infrastructure. So we would urge you to go to the website, and we'll make sure we get it out in press releases as well.
Okay, thank you, Amanda. Up next is Annie Moore with WVVA.
Annie, we can't hear you.
What happens if you're caught violating this order? What happens?
I think that's Brian again. Here we go.
You increase your risk.
Forgive me, I just can't hear you.
We've been working in conjunction with our Attorney General for advice on that, and we believe this executive order is within the governor's broad powers in emergency situations and would be a lawful order. So what would happen if someone doesn't abide by the governor's direction? Law enforcement would be able to order them to comply, and then failure to comply could be charged with obstruction of justice.
Okay, thank you, Annie. Up next is Kara Lofton with West Virginia Public Broadcasting. Kara, unmute your mic, please. There we go. We got you now.
Hello. Okay. Kara Lofton with West Virginia Public Broadcasting. I know efforts to test have increased greatly over the last week, but the reality is we still don't have comprehensive testing like was seen in South Korea. Therefore, do we really know, is this order enough? Like you have said, Governor, and the folks up there with you that is already in the community, is this enough to stop the spread, to potentially prevent West Virginia from becoming in New York or in Italy? And is this different from the direction before?
No, I think it's a matter of how do we all really comply with it and really actively engage doing it. So that is, I think, what's most critical, that we take it seriously and that we work to both keep that physical distance apart from ourselves, to do that good hand hygiene and environmental hygiene, and then that we really work to support each other in other ways. We're putting all those in place regardless of what the testing is. Those that we've been doing that all along, regardless, because we know it's important early. So the testing gives us lots of good data that we can begin to see the trends that occur. We will continue to expand that testing. But again, think about flu in communities, think about colds in communities. We don't do testing for every individual case. We manage those clinically. And so we will do the same with this for folks that are mild disease, et cetera. We do need to use the testing for several priority areas. And so those would include things like testing that helps sustain our healthcare workforce and our essential service workers, folks that have been in close contact with a known case that we are working with, or doing that public health investigation, and then testing for our hospitalized patients, because that changes how we do infection control, and testing for our individuals with at higher risk of poorer health outcomes, so our elderly, those underlying chronic diseases. Those are the folks that we want to make sure that testing throughout the system gets prioritized for.
Hey, Governor, could I just have one? The other thing, because Commissioner Slimp is expert at this, and she's absolutely correct. But I think the other thing is to pay attention to is the difference between the strategy that New York took and our other very populated state, California, took. And California, at earlier times of opportunity, had this kind of an approach, and with holding each other responsible, separating from 6 feet if you are out and around or in a store, staying home if you're sick. They have changed the shape of their curve of how fast the rate of spread is. So they've bought themselves several days. They're busy, but they're not underwater like New York. And they've also changed the slope of that logarithmic curve of spread. So we should have every reason to believe that if we act aggressively and act together and hold ourselves responsible, that we can continue to keep the rate of spread slow in our state, which so far so good. And this is really an investment not just in today, but an investment in a month from now, so that we don't see this start to rev up as a surge.
And I'd like to add just this, is again, just speaking bluntly, our nation as a whole, we were behind in being able to have the testing capabilities that we would all have liked to have had. Mm-hmm. Our state, therefore, could not draw from unlimited testing facilities. We have ramped up, and I give all the credit in the world to Dr. Slimp and all these great people. We have ramped up dramatically. I would also say the more testing we could do, probably the better off we would be. You know, with all that though, the better off we would be always comes back to keeping our distances and doing the things that we're almost bored with hearing, and that is washing our hands and keeping our distances and staying away from crowds and all of that stuff. And so the net of the whole thing is, sure, I wish we'd have had our testing abilities to be much higher, but when you look this down and you say that we've had at least 1,500 people that we have tested, we don't have the results back, now, at this time, 19 communities that are ready to go for community-based testing, and 49 hospitals that are now submitting tests to our public and private labs. It has really, really dramatically ramped up, and I give credit where credit's due. Kathy, you've done a great job, and everybody's working it just as hard as we can possibly work it. Let me mention one other thing. From the standpoint of the public, because so many people, it's easy for people to believe something that is just a rumor or whatever it may be. From the standpoint of our non-essential businesses, the ones that are essential, it's a given that our grocery stores, our transportation network, all of those people that you feel like that you're going to need to be able to access from the standpoint of our banking community and on and on and on, those people are essentials. And so you'll see the list on our website really soon and everything, but we can go on about our lives if we just go on about our lives in a really smart way.
All right, thank you, Kara. Up next is Brad McElhenney with West Virginia Metro News.
Hi, Governor, and everybody. Among the scariest situations with this virus overall is its effect on nursing homes. West Virginia moved pretty quickly. Among the first things that were closed to visitors was nursing homes. Can you further describe, if there's any concept yet, of how this virus got into the Morgantown nursing home, whether it was through a visitor? And I think I heard you say at the beginning that some members of the National Guard have already gone there to take people's temperatures, to see what the overall situation is. Could you elaborate on what you know at the moment about other workers, other residents of the nursing home?
Sure.
I can, Brett, and let me go before you guys go. The experts here know a great deal more about this than I, but let me just touch on what you just said. You're right. We went early on limiting or eliminating visitors to come to our nursing homes. Now, you just think of how difficult that was. We're basically going to say to us, your mom's in a nursing home, you can't go see her. And she needs you to go see her. She depends on that every single day. You can't go see her. And so we stopped all of our people. Now, a big concern that we had is just simply this. Workers that are working within the nursing homes, they're coming home, they're going to Walmart, they're going to different places and everything else. Now, and it has been a big concern. We tried to lock down as best we could. We're trying to take temperatures and do all the different things to ensure that our nursing home community is protected in every way. We've been worried, and now we've got something to really be worried about and everything. And so the general immediately sent 4 people right there to test everybody there, to try to stop any potential disaster that we would have there. We're worried. We're worried about that because so many different ways of invasion of this terrible virus could get to the most vulnerable and then pass from one to another. We're worried, and now I'll let these people speak.
Yes, I would just speak to the fact that what was supposed to happen happened here. So, one is always concerned when you have a case of an infectious disease in a facility where folks are in close contact and they're vulnerable. And so as soon as this one was identified, public health, and then they had partners that they worked with in the community, including the Guard, began that initiated that investigation. So as soon as it was identified, they were right there with the facility, doing that investigation, looking to see exactly what else needed to be found, and what may have happened. So you test the other residents, you assess what's happening, you test the residents that you need to test, you test the staff that may have been in contact with the individual. So you look to see what's happening in the facility now, and then how do you reduce any further spread. And so that happened literally within minutes to an hour or so of identifying a case. That is happening with each of these that we're identifying at this point. You start the investigation and you find the contacts and you go from there. And so this is what we want to see happening.
Brad, just from an operational standpoint, I think it's a great example of what the governor's directed the Guard to do. We quickly provided the testing support for 52 individuals so that the data can go to the lab at WVU hospitals, then could be provided to Dr. Slimp and her team. A backside support asset of Guardsmen will be providing support to the epidemiological effort with data analytics, and those are the things that we can be doing to best support the effort that goes on here, and it's a great example of how interagency teamwork is working right now to address the threats that we need to deal with.
I think you also have to recognize that all of the measures we put in place are so incredibly important, and they do a lot to minimize the risk. They can't eliminate it entirely because you have to keep these services going, and they're critical care. So we do everything we can to reduce that risk. You can't eliminate it entirely.
All right, thank you, Brad. Up next is David Beard with the Dominion Post.
Hi there. Can you hear?
Sure.
My wife has a friend in the Philippines who has soldiers out in the street in front of her house, and she has to have a written pass to go to the store. How do you enforce the stay-at-home order in West Virginia? Can you count on people's good faith when they're still hoarding?
I'm not sure I heard the last part of that. Does someone need a written pass to go to the grocery store?
Yes, my wife's friend in the Philippines needs that written pass to go to the grocery store.
Yeah.
So I don't know, how do you enforce this order in this state?
Hoarding, maybe? Hoarding?
Oh, hoarding. I am sorry. I couldn't hear that. Well, I think that if should that happen, we'll be prepared. The Guard will be prepared. Then the governor certainly will be ready to make a decision if one needs to be made with regard to that.
So let me answer that question, please. So I think we have enough faith in the people of West Virginia to do the things that we need to do. There is no reason and no necessary actions to put National Guardsmen or police officers on the street. We're West Virginians. We're asking people, based on the guidance given to the governor and the governor's direction, to do these things to stop the spread of this. The most important role of the National Guard right now is to provide the kind of support that I just talked about to make sure we deal with the threat appropriately. This is the threat of a virus. So I think that I'm confident, I know Governor Justice is confident, that the people of West Virginia are going to step up and do what we ask them to do to limit movement where possible, to maintain only essential services that we need to, and go through this. Certainly we as West Virginians don't have to have that in our state.
I want to speak to one essential service, just to remind folks too, since we're dealing with healthcare issues, that supporting our blood drives is really important. That is an essential service, and they are working, the Red Cross and others are working to make sure those can be done in safe and effective ways. So that is another essential piece to continue.
Okay, thank you, David. Up next, we have a follow-up question from Kenny Bass with WCHS. Kenny, go ahead.
Yeah, I have a question concerning Workforce West Virginia. The governor mentioned there was a massive response, 17,000 cases last week, but we're hearing from many people who are calling and not getting any answers. The system is crashing, et cetera. What can be done to physically increase the capacity of Workforce West Virginia, both online and on the telephone and at the actual location, to be able to process what you think may be an even bigger influx of claims this week?
Let me lead off, Brian, come up here, but let me lead off by just saying just this. Kenny, I tried to knock down as many of the barriers right off the get-go that would give us the ability to process and process immediately. You know, I'm not being passive about anything here in any way, shape, form, or fashion. I truly understand, being a business guy, very, very well, that people that are at home without a paycheck are worried, and they're worried about the economic ramifications of the whole thing, and rightfully so. You know, businesses are absolutely worried. You know, so there's so many different aspects of this from the standpoint of the economics that I'm surely not being passive about. But Brian, if you could come, maybe you could outline more specifics about the law.
Kenny, what we've been told over there is they brought back retirees, they've added temporary workers, and they're working around the clock. They've tried to work with the bank that puts out the cards and encourage them to do so. They've averaged before as much as $5,000 a month, and they did $17,000 in a week. So they're working around the clock. Just today, the governor signed an executive order that deemed all those people essential employees, so they'll be required to stay and work through this crisis.
And the only thing I would do is just add just this. Some way, somehow, we're going to get through this from an economic standpoint with our nation and our state stepping forward and doing what needs to be done to keep our people whole. And I know it is a monumental effort in every way, shape, form, or fashion, but that's going to be done.
Okay, thank you. Another follow-up from Amanda Barron with WSAZ.
Sorry, I had to get to the right screen there. Okay, is there a timeline at this point for determining when or if schools will be going back in session, and when will you make that decision?
I don't think we have a timeline for that, and I think we need to watch and see what happens. This is what we're working to really make a big difference in our communities, and we need to be taking a step at a time and assessing where we are, and we will make that decision when the time is right to do so.
And Clayton Birch is here with us today, our superintendent, and he does a magnificent job. He's doing great stuff, and if anybody had ever just kind of signed on right at the time that all this has happened in every way, I could tell him, he knew the job was dangerous when he took it, but he surely didn't probably know that it was anything like the magnitude of the problems we're into now. He's doing a terrific job. He'll give us his recommendations and guidance as well. We've got to be assured that everybody is safe, especially our children and our teachers and all those that work at the schools. We're not ready to go back to school now, and we'll just keep you updated on that.
Okay, thank you, Amanda. Another follow-up from Hannah Getz at WOWK.
Hi, yes. You were talking about implementing university med students, I believe. Can you explain that a little more? And is there enough supplies to add them to the list of medical essential personnel?
Well, actually, it's using them in interesting, creative ways. We're doing the same thing we're asking other people to do. So one of the thoughts with not having med students in clinical services right now is that they actually are able to, some of the supplies, equipment that we needed could be used by the other healthcare workers. It doesn't mean that they stop service, however. And so the universities have nicely made a community service available as a credit to our medical students, and we would think about using them in such things as some of the remote checking in on folks that are ill or contacts, or helping with some of that other medical behind the scenes work. So there's lots of ways that they can be used, answering questions, using their knowledge in ways that are not necessarily frontline patient care.
Yeah. The governing bodies of all of our medical schools have made it clear that particularly right now during this novel coronavirus pandemic, that it is not appropriate to have our medical students do clinical care. And so what we are trying to do, and Dr. Slimp correctly identified opportunities for people to contribute, but one of the reasons why we don't want medical students on clinical services right now is because, number one, we don't want them to get sick, of course, but number two, we also want to conserve the personal protective equipment that is necessary for our frontline workers and for people that will be in hospitals to work. So those combinations of things is important. As a workforce potential accelerant, you know, people across the country have talked about what's the surge plan if people and places get overwhelmed. And at that point, there may be consideration of getting everybody back into the care environment. But right now, the guidance and I think the right thing to do is to not have these students participate in clinical care.
All right, thank you. We're going to go back to Brad McElhenney for a follow-up.
Hi, you know, if people are still absorbing this in their heads, if you're an average person and you think, well, what am I supposed to do? How am I supposed to behave? Can you describe, paint a picture for people what they should do? For example, you don't go to Walmart and just entertain yourself. You don't, maybe you're going stir crazy. You can spend your time with your nuclear family, but maybe you don't want to invite the neighbors over. Just maybe can you help me tell people what's the expectation for behavior?
I can do some basics.
Let me make an attempt. I mean, you know, Brad, how I would look at this is just this way is, you know, in a lot of ways we may have gotten, as the community in general, or as the people in general, spinning awfully fast in life in lots of different ways, and we may have overlooked some of the very things that provide us the happiest moments and everything, the very things that mean the most to us. So I would try to tell people to seek those moments as best they possibly can. Naturally, I mean, it is a tremendous inconvenience in every way, shape, form, or fashion, but the reality is we've got to find a way for all of us to be able to survive. And we all believe that this is going to pass. We don't know how quickly it's going to pass, but we all believe it's going to pass. And so I would encourage everyone in every way, shape, form, or fashion to, if you want to go outside and go for a walk, you want to walk over and say hello to a neighbor, keep your distance and all that kind of stuff. You want to visit with family, do the same kind of, precautions, wash your hands, all that bit and everything. If you want to go to one of our state parks and walk or try to catch a fish or whatever, we encourage you to do that and everything. There's going to be all types of things, if you call in a carry out at a restaurant and whatever like that, that's going to be a process that continues on, and we're just trying in every way, shape, form, or fashion to do the best we can with the cards that we're dealt. And these are tough cards. That's all there is to it. So it's surely going to be a significant inconvenience to all. But I would tell everyone in every way, shape, form, or fashion that God above gave us the abilities to draw upon ourselves from our standpoint of joy. And so there's so many things that we got spinning so fast on and everything that maybe we've missed a lot of joy in our lives. And so now may be a time to turn back to that joy in a lot of ways.
From the very practical standpoint, I can speak to what I would see my family doing. So if you're going to the grocery store, if you need to get groceries, you go to the grocery store. There are some grocery stores are doing it in different ways in terms of packing ahead and delivering, or you go at a time when it's not crowded. And so you actually you just make sure that you are a distance from other people as you're doing that shopping. If you need to go to the pharmacy, you get in the car, or you go to the drive-through with that. Or stop in if you are, again, without having to be in big crowds. house. You do takeout at the restaurant. You need your car to go to your essential service work, and it needs a repair, and it's a critical repair. You work with the repair shop to do that. You connect with your church and other community support systems in different ways. So I think there's a ton that you go out and do all those things that the governor mentioned in terms of being outside and enjoy, and you have the opportunity to really intentionally connect with each other in new methodologies. And I think people have said that's really been important because they actually feel like they've been connecting even more because folks have been so intentional about it. So I think those are the things that you can do and that really make a difference. I think that's the opportunity that we've got.
Governor, if I could add one thing. So I think, Brad, important to also understand, too, there's some really great work going on out there right now with the current essential businesses. I'm engaged daily with the Retailers Association, reference additional protective measures for their employees, as well as they're closing stores, doing deep cleanings before they open back up again. They're doing a lot of additional things. Our manufacturers are implementing things so that their critical employees stay healthy, safe, and don't spread the virus. Our utility companies are doing additional things and additional measures. So those are also a population out there that are doing things that the governor has asked to be done that is going on to keep those essential services running and keep the employees of those essential services and their families healthy.
Governor, can I say one thing? Sure. So I think, Brad, the other point that's very important is why do we do this and what's the goal? And I think that it's becoming more clear that the main way this virus spreads is through people picking up on their hands and introducing it to their face. There is a concern if somebody's sick and coughing around you, you need to have distance. But I think clearly now it is the spread by droplet and by person to person through contact. So one of the things you want to make sure of during this time is you're minimizing interaction with people that are not sort of living in the same house. And the three things you should do is wash your hands, as we've talked about, and those instructions are all over the place now, very thoroughly. Every time you go outside and come back in, touch a door handle. You should keep your counters clean, doorknobs, and those kind of things. You just need soap and water and just clean them off. And then keep your hands away from your face. And if we do that effectively, then we will slow down the spread of this virus dramatically.
So I don't think the worry is that we see people out individually or in their family groupings doing these activities that we all need to be doing. It's if we were seeing people really gathering in large groups. That's what you would worry about.
Okay, thank you. Back to Hannah Getz with WOWK.
Thank you, Hannah Getz again. We have a question coming in from our viewers, and they're asking about prevention methods in jails and prisons.
Jails and prisons.
Sure.
Oh, very good. That's another concern for the state of West Virginia, and we had a report in another state of a an individual in a correctional facility acquiring the virus. So we're looking at that carefully. We're working with DMAPs on that. Kathy may have more of that down at her level.
Well, I think, that is another example of we have institutions where folks are together in close contact. So whether it is nursing homes or whether it is jails or prisons or corrections and other long-term other facilities. So any of these settings where we have lots of people together, especially with high-risk populations, you take all the precautions that you can take with that. And so we work in the Department of Corrections as well in addressing that. And so they screen staff and they put in the same measures that we talk about in many of the other settings. And the other piece is you actually make sure those are essential service workers and protect them.
And that is a good point. We haven't talked about that before, but there's a plan there that's being implemented for the correctional facilities.
Okay, thank you. Up next, we're going to go back to Amanda Barron with WSAZ.
Hi, Amanda Barron with WSAZ. Two questions. First, will there be any certain or specific ID that essential workers will need to carry with them as they go out during the stay-at-home order? And second, I've taken a call about a business who's not allowing people to work from home even though they have the capability to do so. Is there anything that you can tell employees who might feel like their concerns aren't being taken seriously, anywhere they can call to have that investigated, that claim or question investigated?
There will be no ID required for individuals who are out for a specific purpose. Again, people have to eat, people have to go to the pharmacy, people have to fill their cars up with gas. Essential services are those that you need in your life to continue functioning in your life. So it's not a situation where someone has to have an approval to go somewhere. It's basically common sense in terms of what an individual needs to keep their family fed and to keep their family together and take care of their family. So there are lists, and again, it's on the website. The document is on the website that gives a lot more information on that.
You know, I mean, West Virginians are smart, creative, and practical, and they understand that this is about protecting themselves, their families, and each other and their communities. And so we believe people can do this. You don't need IDs, you don't need orders. Otherwise, you know, in terms of individual things with that, people do the right thing, and we believe that could be done well.
Amanda, let me just say, you know, it's a great question. You know, people would probably be concerned, you know, appreciate your question from the standpoint that we're telling them they don't need IDs. From the standpoint of a West Virginia employer compelling people to stay, to be at work when maybe they could be doing the work at home, you know, that's no good. And I would really appreciate someone, you know, telling us who that would be. Maybe we could, you know, have a heart-to-heart with them and you know, turn things around in the right way, but we need to know that the overwhelming majority of all of our people are doing the right stuff, and they're trying. And remember just this, if we can get 75%, you know, we can break this disease from the standpoint that it is manageable. If we could get 90%, and to use Dr. Marsh's, you know, numbers, 75% this thing becomes not a tsunami but a river. At 90% participation, this thing becomes a stream. And then our healthcare professionals can protect us and take care of it. Now listen, have we got more questions, Jordan? All right, one more. Okay, let's go.
Okay, next, coming back to Brad McElhenney for 2 questions.
Hi again. Thanks for being patient with me. I'm getting plenty of questions from listeners and people out there, as I'm sure everybody is. So if I could just do maybe 2 for 1. In terms of particular sectors, one of the questions I've gotten is, what about daycares? Still important to keep those open is my question. And then, unfortunately, an economic question about state revenue. Any revenue adjustments up ahead, and any particular moves to try to shore up what the state is spending in this time.
You do the daycare, I'll do the spending.
Right. You know, childcare is an essential service that allows our parents and our families to do those other essential services. And so it really is a critical piece. And so we've got daycares have remained open. The state licensing folks have also worked to develop some guidance around how to set up additional ones that can support, for instance, workers in a healthcare system or other essential services. So these are critical pieces. We have to both take care of our children, and we have to allow their parents to serve the rest of us.
From the standpoint of our budget, you know, Brad, this is no question materially affecting, you know, our budget. As we go forward, you know, there's many different things that will be happening. You know, if we come out with a nationwide stimulus package that is $1.8 trillion. I mean, it's from a standpoint of just purely economics, It's mind-boggling the amount of dollars that we're talking about there. But just imagine the nationwide infrastructure program is going to fix all the roads, fix all the airports, fix all the bridges and everything. Began at $1 trillion, and this is twice as much as that. It really, the economics will be okay. Now, out of kilter for a period of time, no question whatsoever. Let me even compound that situation. If we were to extend the filing of state income tax in compliance with the federal government to July 15th, we would be going into another fiscal year, and you'd have a real upside down situation to where you had to maybe draw from rainy day, pay back into rainy day. There's all kinds of different issues that you've got to address there. But our people are on top of this. Secretary Hardy is working it in every way. We were tracking, to really be able, if this hadn't to come, we were tracking ahead and everything to erase any kind of deficit, and March should have done that, and then we should have been off and running, but we'll deal with it. That's what we got to do. Okay, let me just, halfway summarize and bring this to a close. There's a couple of things that we missed along the way, and one is the fact that we need to urge anybody and everybody we can to contact the Red Cross and give blood. I mean, that's still something that's in bad need, and we really want to try to encourage you in every way, shape, form, or fashion to help there if you can. From the standpoint of supplies, whether they be masks or protective suits or ventilators or whatever it may be, I have surely directed the National Guard and everything to put together basically almost a strike force, to where we're doing it around the clock. And I think, our general is doing that now and doing it in a great way, and to where we're soliciting trying to flip every rock to find every single piece of supply equipment that we need in every way. I've got to thank our businesses for all the participation and all the goodness that they're doing in trying to help let workers stay home and do all those things. But the people that I want to thank more than any are our healthcare workers. They are our lifeblood. And they're the very people that not only do we thank and recognize all their effort, they're our front line defense in every way, and we have to protect them. We've got to protect them, because if we lose them, you just think what's going to happen. We're just going to spiral out into no man's land. And so absolutely, some way, somehow, we'll get them all the equipment that they need to protect themselves, and we'll try to do anything and everything we can possibly do to help their families. And I guess, from my standpoint, that's about it. I think we're on top of it, and we've got great people that are working it, and we're going to continue to say the biggest prayers that we can possibly say, but more than anything, we're going to stay on top of it. We're going to do our job.
All right, thank you, everyone. With that, the governor's briefing has come to an end. Thank you.